Savvy Business Radio, home to over 500,000 listeners per month, and runs in syndication on 8 AM/FM stations nationwide, including iHeartRadio and 6 podcasting platforms. To find out about our paid sponsorship opportunities or to become a guest and find out how we can help you get your message out in a bigger way, call 732-474-7375 or email Christina at savvybusinessradio.com.
Welcome to Savvy Business Radio. This is your host, Christina Nichman. Each week on Savvy, we support individuals and successful individuals in sharing their expertise, knowledge, tips, and stories with the world. Our guest today is Dr. Peter Osborne, author of No Grain, No Pain, a 30-day diet for eliminating the root cause of chronic pain. Some of the topics we'll hit on today: how can gluten or grains negatively affect your health and that of your infants and pets? We'll also discuss the correlation between gluten, autoimmune disease, and chronic pain. Find out more about Dr. Peter Osborne and get his book today at NoGrainNoPainBook.com. Hi, Dr. Peter Osborne. Welcome back to Savvy Business Radio. How are you this evening?
I'm doing fantastic. How are you?
I'm doing great, and I want to thank you again. We had a bit of a glitch. You came on and did a wonderful interview with us almost a year ago on your wonderful book called No Grain, No Pain, a 30-day diet for eliminating the root cause of chronic pain. And I know that our audience is going to get a lot of benefit out of this interview. I think I told you in our last interview together that I actually took the 30-day challenge and read your book fully, and it really helped me eliminate a lot of, the pain I had in my back for one, and also just a lot of tiredness and fatigue. So we're going to get into all of that, but before we do, share with our audience a little bit about your background, how you came to working with helping people in particular in their diet and such.
Well, I actually started I was training in the VA hospital, going through a rheumatology rotation. Rheumatology is the study of autoimmune diseases that are affecting the joints or the soft tissues. So things like rheumatoid arthritis and lupus and scleroderma, and migraine headaches and dermatomyositis, etc. So these are debilitating diseases that can shave years off a person's life. And so being in that setting, unfortunately, no one ever got better. The patients would come in, the attending physicians would prescribe medications to treat their pain, but ultimately the patients never got better, and the side effects from the medications, really deteriorated their quality of life even further. And to me, that was a frustrating environment to work in, and I just didn't want to continue to do that. It didn't make sense to me to do something that wasn't working or serving the patient. And it was the Veterans Administrative Hospital, and I'm a veteran, so I felt like we owed our soldiers a lot more than what we were giving them. So what that led me to is it led me to research, and so at the time, this was in Houston, and I had access to one of the largest medical databases in the world at the Jesse Jones Library. And so I started doing research on causes of autoimmune pain. And what I found was very, very interesting. I found that we actually only knew of one cause for autoimmune disease that we could scientifically validate, and that cause was gluten. And so that's what got me thinking about gluten in general. But then I found some other very, very interesting research. One was that there was research on fasting. So if you would take patients with chronic pain and you would take away food for 48 hours, that you would see a dramatic improvement in their pain within 48 hours. And that kind of putting two and two together, you've got gluten as being a known cause of autoimmune disease. You've got fasting as being a solution for resolving pain in as much as 48 hours. So, it doesn't take a rocket scientist to put two and two together there. And that's what I did. The other research I found that was very compelling is that you had research that showed that omega-3 fatty acids were as equally effective at pain management and pain control as non-steroidal anti-inflammatory drugs like ibuprofen and naproxen and Celebrex, some of the main drugs that get used today to chronically manage pain. And so taking those three pieces of information, the gluten, the fasting, and the omega-3 fatty acids, I approached my attending and asked him if we could pull a few people aside and just kind of do a small-scale trial in-house where we say, okay, look, these people over here, we're going to take 10 people, we're going to teach them about gluten, we're going to implement a fasting protocol, and we're going to implement some high dose fish oil or omega-3 fatty acid in their diet. And I was completely shut down and told, no, we're not going to do that. And I was told that the science didn't exist and that there was no evidence for what I was claiming. Now, I understand there was a lot of evidence, and it was really frustrating for me because here, a lot of the research that I gathered and collected was actually pulled out of rheumatology journals. These are major peer-reviewed journals where the research is done by our colleagues, by other PhDs and medical doctors and doctors specializing in the treatment of autoimmune conditions. And I was being told that the research wasn't valid by somebody because they didn't want to implement it, not because it wasn't valid. So for me, it was a really, really big turning point in my life, because it was shortly after that I left the VA environment and started my own private practice. And one of my very first patients in private practice was a little girl named Ginger. She had a terminal diagnosis. She'd been diagnosed with something called juvenile rheumatoid arthritis and been given 6 months to live. And so the very first thing I did was I tested her for gluten sensitivity. And she was gluten sensitive. And so then, the challenge that I had with her was that her favorite food was pizza. And because she only had 6 months to live, her mom didn't want to take away her favorite food.
Yeah.
So fortunately, her mom had juvenile rheumatoid arthritis. So I was able to convince her mom to go gluten-free. And her mom felt so much better within a very short period of time that it was enough to convince her to take her daughter gluten-free. And so the end of the story, what ended up happening is that within about 6 months, we had her in remission, and we had her completely off of medications and with no pain, the young girl who was terminal, who only had 6 months to live. And it was in that point in my career where I knew I had to get this message out, because 50 million people in the United States alone suffer with some form of autoimmune pain, and they're being treated the way all these other patients in the VA hospital were being treated. And it's just a horrific, horrific process. It's a horrific way to make people accept that they need to be sick for the rest of their lives and hurt for the rest of their lives, just because doctors aren't willing to look at nutrition as an important fundamental foundation for health.
Wow. Well, that's amazing, Dr. Osborne. For the fatty acids, I'm assuming that you helped your patients get that into their bloodstream via supplements as well as eating fish and such, or how does that work?
Yeah, so to get somebody who's really got a severe autoimmune pain condition, most of them we actually test. My creed is test, don't guess, because you can guess wrong. So I actually test my patients for omega-3 fatty acid deficiencies and discern what it is they need, so that I can also work out what dose is going to be an acceptable dose to get them where they need to be. So that looks like highly concentrated omega-3 fatty acids in the form of something called EPA and DHA. And so we use that, and at varying doses depending on the level of deficiency that our patients have.
I love that you test for that. A lot of doctors who do pay attention to a bit of nutrition don't think to do testing first. Where are you at with all your mineral levels, your nutrition level? What's going on? What are you missing inside your body for your particular self? For me, I think I noticed being on your diet, after 3 days, my back pain was gone. Now, I didn't do any fasting, and I wasn't really paying attention to huge omega-3. I think for me was just paying attention to not eating any grains. And that's what I want you to let our audience know, because I used to think before I started your diet that I was actually on a gluten-free diet, and I wasn't. Explain why some people who think they might be eating gluten-free might not.
Yeah, I mean, that's why I wrote No Grain, No Pain, was because, and it's not just another gluten-free diet book. So many people think, oh, it's just another gluten-free book on the trend and the bandwagon. But I wrote it because there's this huge disparity of knowledge about what gluten actually is. So, I mean, the actual technical definition of what gluten is it's the family of proteins found within grains, within the seeds of grass, which is what a grain is. And it's all glutens, not just select glutens. Unfortunately, the FDA has a limited definition of what gluten is. So they only define it as wheat, barley, and rye. So they can, by law, food manufacturers can, for example, they can make oats or oatmeal. They can package it and they can put a gluten-free label on it. They can make corn chips and put a gluten-free label on it. They can make a rice product or rice noodles. And a lot of these quote-unquote gluten-free products contain corn and rice and oats and sorghum, and they all contain some forms of gluten. And so these people with gluten sensitivity, what happens is they gravitate over to eating these quote unquote gluten-free foods that aren't really gluten-free. And they feel a little better because they've changed their diet and they're avoiding the wheat and the barley and the rye. But what ends up happening is they still have struggles and they still have chronic inflammation. They still have problems because they're still getting exposure. So that's one element, is that to truly be gluten-free, you have to be grain-free. Now, one of the other problems in grain, even if we just throw gluten out of the window and say, okay, we're not even going to talk about gluten, let's talk about some of the other qualities of grain that make it dangerous for people. A lot of people don't realize this because they weren't alive when it happened. But in 1943, the United States government banned the sale of grain. They said, no more, we're not selling grain anymore unless you, as the food manufacturer, fortify the grain with vitamins. And the reason why that law exists, it's a food labeling law, the reason why it exists is because grains were creating such horrid nutritional deficiencies that they were responsible for over 7,000 deaths a year. And this is where our food fortification law came from. So when you look at a box of cereal or a bag of pasta or rice or corn, you'll see that it is fortified with, always 100% of the time, because it's illegal to sell it unless you fortify it. It's always going to be fortified with vitamin B1 and vitamin B3 and iron and folate. So it's always going to contain these things, because if it doesn't contain these things, it actually it's so malnourishing to eat that it creates enough disease that kills people. And again, people don't realize that. The grain manufacturers didn't come back and say in 1943, they didn't come back and say, quit eating us because we'll kill you. What they said is, eat more of us because now we're fortified with vitamins, so we're even better for you, right? So it was a play on words. It was a twist on words. And a lot of people just weren't alive at that time, so they don't have any recollection of that history. So we look at just the component of grain, it's malnourishing in and of itself because it causes vitamin and mineral deficiency. But then there are other components in grain, especially grown in the U.S. There are a number of different pesticides that are used in extremely large quantities, like glyphosate and atrazine. These are very, very toxic to humans in high quantities. And what we see is record levels of, especially in infants, because most infant formulas are made of grain, especially corn. So we see record levels of gastroesophageal reflux disease and so GERD, acid reflux in babies who are being formula fed. We see record numbers of this because of grain-based formulas. But we also see that a lot of our grains, besides the pesticides, they're also high in molds and mycotoxins because of the way that we store them. So when we harvest the grain and store it before we process it, it has a tendency to grow mold on it. And this mold emits something called a mycotoxin, and these mycotoxins can be extremely toxic to certain people. So a lot of people who eat grain, they may not even be gluten sensitive. They may just be mold sensitive, and they're eating heavy quantities of mold because of, the way the grain is processed in our country. And then scientists recently discovered there's this new term being used. It's not really a new term, but it's new to most people. The term is non-celiac gluten sensitivity. And so there are people that are gluten sensitive that have the disease, celiac disease, which is an autoimmune disease of the small intestine. But then there are these people that don't have celiac disease, but when they eat grain, they have chronic pain and chronic inflammation and develop other forms of autoimmune disease. They fall under this category of what's called non-celiac gluten sensitivity. And in a couple of research studies that have just recently been published have identified there's this new family. They're not a new family of proteins. They're newly discovered family of proteins called ATIs. ATI stands for amylase trypsin inhibitor. These are proteins found in grain that actually shut down the human pancreas. They prevent your pancreas from making digestive enzymes. So when you eat the grain, instead of your pancreas making enzymes so that you can digest it, the grain actually rots in your gut, and it causes a change in your healthy bacteria, and it creates an inflammation in your gut that rips a hole in your gut lining. And a lot of people are now referring to that hole as leaky gut or intestinal permeability. And this in and of itself is a precursor to the development of autoimmune disease.
Wow. So this is really intriguing. And I know people listening in are going to get a lot out of this because I was diagnosed a couple of years ago with Graves' disease. And Almost, I kid you not, Dr. Osborne, almost everyone I know over the age of 40 that is close to me has some form of autoimmune disease. And that cannot be an accident. It's just totally off the charts, crazy. And I think there's a correlation to what I'm hearing you say here about the non-celiac or predisposition to the gluten not working for them in some fashion. Does that kind of correlate?
Absolutely. So, I mean, here's the way I would ask your readers to understand it. Everybody is so hell-bent on looking at celiac disease, and they're missing the forest through the trees. And the doctors are the worst at it, because understand this: a person can be gluten sensitive and never develop celiac disease, but develop autoimmune diseases of other natures. There are over 90 forms of autoimmune disease that we have documented in medical literature and in clinical literature, and celiac is just one of them. So we can make the statement that everybody with celiac disease is gluten sensitive, but not everybody with gluten sensitivity will develop celiac disease. We could also make this statement: people with gluten sensitivity who don't develop celiac disease oftentimes develop different forms of autoimmune disease, like Hashimoto's and Graves and myasthenia gravis and scleroderma and dermatomyositis and lupus and ankylosing spondylitis and lichens planus. I mean, there's a huge, long laundry list of conditions that are autoimmune conditions that are linked to gluten exposure. But because doctors aren't trained in nutrition, if that patient has autoimmune disease, they're not thinking gluten. They're thinking, oh, it's autoimmune disease. We don't know what causes it. Let's drug them out of their mind for the rest of their life and just tell them that that's all that there is. That's all that we can do. We can suppress your immune system with really powerful drugs that eventually will give you cancer. And so you'll die from using the drugs to mitigate your symptoms, but will never really resolve why your problem is there. And so autoimmune disease, fundamentally, a big part of the autoimmune component has to do with not just gluten. Gluten is part of it, but grains in general. So grain, there's gluten proteins, there's mold proteins, there's pesticides within the grains, there's amylase trypsin inhibitors in the grains, there's high levels of the fat omega-6 in grains that are pro-inflammatory and cause more inflammation. So there's all these qualities about grain that we've been sold, eat your whole grains as a bill of goods. And if that were true, then all these people that are eating all these whole grains that are chronically sick wouldn't be chronically sick.
Yeah, absolutely. And you touched on something before that I've never heard, which is the baby formula, a good portion of it having grain. I didn't know that. But here's something interesting. My dog, which I recently got from the pound, he came to me with acid reflux. And I know he was eating mostly dry food, and I'm guessing that dry food might have had grains in it. So does this also come about for animals as well as humans?
It does. So understand that all dogs are gluten sensitive.
Wow.
All cats are gluten sensitive. If you look at the number one ingredient in most pet foods, it's some type of either hydrolyzed corn protein or it's some type of other grain protein like a wheat. And the reason why is it's super, super cheap to grow it. We can add a little meat juice to a bunch of grain and we can feed dogs very cheaply, but charge people a lot of money for dog food. And if we look at the diseases, if we look at vets and the chronic nature of our pets and how they have the same graph, if we graph diseases in pets, especially autoimmune diseases and cancers, we see that as dog foods and pet foods change to grain-based, we see this exponential rise in disease in our animals as well. So I'm glad you brought that up because I've got 2 dogs myself. And I feed them raw. We don't feed them any kibble at all. We feed them raw meat because that's what dogs are. They're carnivores, and they need to eat raw meat. They can eat table scraps. We've always heard about how unhealthy table scraps are for our animals, and they can be. You should never feed a dog cooked bone because it can splinter in their throat. But raw bones, dogs can actually chew them and swallow them whole, and they're very, very healthy for dogs. They're healthy for their teeth. It's part of how they keep their teeth clean. And it's part of what their nutritional needs are. You don't ever see wild animals, right? Wolves or coyotes having a splintered bone in their throat, killing them, right? Yeah. And we've taken this whole thing and we've said, look at our dogs. Let's feed them a bunch of food that they would never eat in the wild. And let's just hope for the best that they don't get sick. And the actual opposite has happened. So there's a real, I'll plug another book here if you don't mind. There's a book called BARF. BARF stands for Biologically Appropriate Raw Food. And this is a great book. If you're ever thinking about feeding your dog or your cat appropriately, check out the BARF diet, because it might just save them from a slew of health problems, and it might save your pocketbook from a slew of vet bills.
Wow, this is fabulous, because the vets pretty much told me to feed him Pepcid when it gets really bad. But I'm like, I don't want to put my dog on Pepcid for his whole life, and nor should any human have to be on Pepcid for his entire life.
Well, shame on that vet. That's horrible advice.
Yeah, well, thank you so much, Peter. Now, let everyone else know out there that there are options, and your book is number one, to go out there and get that today so that they can find a different way to go about eating and, of course, being healthy. Is there a few tips you can give us today to getting on the road to being grain-free?
I think simply avoid the obvious, right? So when you think of grain, think of bread, pasta, cereal, pizza, donuts, bagels, those types of things. I mean, those are where the big hitters are. Think of corn chips, think of rice. That's, a lot of people saying, oh my gosh, what am I going to eat? and that's because their diets are basically totally grain loaded.
Yeah.
And so my advice is I would encourage anyone listening with autoimmune disease, anybody listening with chronic pain, and they've just been diagnosed and they've not been told why they're sick or why they have that problem or why they have that chronic pain, take the 30-day challenge, cut the big grains out, get the right nutrition in your diet, supplement with the right supplements that will actually move the needle. I lay all that out. There's a 30-day program in the book. There's 31 recipes. There's a 7-day diet platform to follow in there as well to kind of get you started on the right track. But it's not as hard as you think once you kind of break it down. So don't feel overwhelmed by the thought process of taking grain out of your diet, because there's a lot of meat, there's a lot of vegetables, there's a lot of fruit, there's a lot of nuts. And the chances are, if you feel paralyzed, it's because you haven't explored those other options yet. So part of the process of healing and part of the process of getting healthy is exploring those other options and enjoying food again and experimenting in the kitchen again.
Ooh, good one. Good one, Dr. Osborne, because it's true. I found in the beginning, like, oh my, what am I going to eat? And I know you mentioned this in your book, that breakfast is our biggest grain fest. I mean, when it came to breakfast, it was like everything I ate was grain filled. There wasn't anything that I ate for breakfast that didn't have grain in it. So trying to find, okay, I'm just going to have fruit. My initial response is, I'm going to be starving if I just have fruit. And of course, that's not the case. So you're right. You begin to appreciate, you begin to enjoy these fruits and vegetables, some of which I hadn't tried before. And I'm hoping others will go out there, get your book and try them. No grain, no pain today. Great. And they can get that on Amazon, correct? Amazon, or is there another website they can go to and get your book?
So if they want a bonus, we've got a really nice bonus for people who buy the book. You can buy it on Amazon. You can buy it in any major book retailer across the country. But if you go to nograinnopaybook.com, you can, once you buy it, you can insert your receipt number on that website, and we're going to email you a wonderful bonus. It's a supplement guide with what's called a leaky gut bonus guide, which is a 60-page manual that will give you a lot of great tips and tricks on how to overcome chronic pain and autoimmune disease that aren't in the book.
Wow, that is such a wonderful, wonderful gift. And I want to thank you again, Dr. Peter Osborne, for coming back to Savvy Business Radio.
Thanks for having me.